How many eggs should you eat per day? The answer depends entirely on who you are, because what is perfectly healthy for one person could be genuinely dangerous for another. Your neighbor eats 3 eggs every morning and his doctor is happy. You eat the same 3 eggs and your cholesterol shoots up. Same egg, 2 completely different outcomes. That's not a coincidence, that's biology. And that's exactly what this video explains. Today we're covering diabetics, heart patients, high cholesterol, healthy people, and people trying to lose weight. And I'm saving the most important part for the end. What if you have 2 of these conditions at the same time? Because most of us do, and almost nobody talks about what to do then. Let's get into it. First, why is there even a debate about eggs? 1 egg has about 200 milligrams of cholesterol. For years, doctors said that was dangerous. People got scared. But here's what newer research found. The cholesterol you eat doesn't automatically become cholesterol in your blood. Your liver controls that. What actually raises your bad cholesterol more is saturated fat. Things like butter, red meat, and fried food. Eggs are low in saturated fat, high in protein, full of vitamins. But not everyone reacts to them the same way, and that's what makes this complicated. Let's start with diabetics. If you've been avoiding eggs completely out of fear, you may actually be missing out on something that helps your blood sugar. One study followed diabetic patients eating 1 egg a day. Their fasting blood sugar dropped by 4.4%. That's a real improvement, and a review of 10 different studies found that eating 6 to 12 eggs a week, 1 to 2 a day, had no negative effect on cholesterol, blood sugar, or insulin in diabetic patients. But all those studies had one thing in common. The eggs were eaten as part of a healthy diet. Vegetables, whole grains, lean protein, not white bread and butter every morning. So if you're diabetic, 1 egg a day is generally fine. 2 a few times a week is okay. But what you eat around that egg matters just as much as the egg itself. Now, heart patients. If your doctor told you to cut eggs and you've been eating dry toast every morning, there's actually a better way. If you've had a heart attack, a stent, or any heart procedure, the American Heart Association says 1 whole egg per day is your safe limit. But here's something interesting. A 2025 study found that eating 2 eggs a day, as part of a diet low in saturated fat, actually lowered bad cholesterol, compared to people eating a high saturated fat diet. What does that mean? The egg is not your enemy. The bacon and butter sitting next to it might be. For heart patients, 1 whole egg a day. If you want more protein, egg whites are your best option. All the protein, none of the cholesterol. Cook them simply. Boiled, poached, or scrambled with no butter. Not fried. And in a moment, I'll explain why some people can eat eggs every single day for years with no problem, while others see their cholesterol spike within weeks. The reason comes down to one thing: high cholesterol. If you've been eating 2 eggs every day thinking it's fine because you feel okay, this is the section for you. 1 egg yolk has roughly 200 to 275 milligrams of cholesterol. For people with high cholesterol, many doctors suggest staying under 200 milligrams total per day. That means 1 egg yolk already puts you at or over your daily limit. Does that mean no eggs at all? Not necessarily. Egg whites are your best friend here. All the protein, none of the cholesterol. Have 2 or 3 egg whites with 1 whole egg if you want that yolk. Now for healthy adults. This is the good news section. If you're healthy and you've been limiting eggs out of old habits, you may not need to. If your cholesterol is normal and your heart is healthy, Harvard says up to 7 eggs a week is safe. That's 1 a day. And here's a finding that's especially important if you're over 60. A study of nearly 19,000 adults found that people eating about 1.5 eggs a day had 72% higher bone density in the hip and 83% higher bone density in the spine. For anyone worried about weak bones or osteoporosis, that is significant. In fact, the American Heart Association specifically says that older adults with healthy cholesterol can have up to 2 eggs a day because the nutritional value is that high. What about people trying to lose weight? If you've been skipping breakfast or eating sugary cereal to lose weight, eggs are probably a better option than you think. Eggs are one of the best foods you can eat when trying to lose weight. 1 egg has 6 grams of high-quality protein. Protein keeps you full. When you eat eggs for breakfast, you stay satisfied longer, which means you eat less the rest of the day without even trying. 1 to 2 eggs for breakfast is a smart move. Just don't surround them with butter, cheese, and processed meat. Now, this is the part most people watching actually need. What if you're diabetic and have high cholesterol? What if you're a heart patient trying to lose weight? Most of us have more than one of these things going on at the same time, and almost nobody explains what to do then. Here's the simple rule. Always follow the strictest guideline of the two, diabetic and high cholesterol. Follow the high cholesterol advice. Limit whole eggs to 3 or 4 a week, use egg whites for the rest. Heart patient trying to lose weight. 1 whole egg a day is your ceiling. Use egg whites to boost protein without the risk. The more conditions you have, the more important it is to not guess. Get your blood tested every few months. Your body will tell you exactly what's working. You just have to check the numbers. Let's bring it all together. Diabetics. 1 egg a day is generally safe as part of a healthy diet. Heart patients. 1 whole egg a day, cooked simply. High cholesterol. Limit to 3 or 4 whole eggs a week. Use egg whites. Healthy adults. Up to 1 or 2 a day. Especially good for bone health if you're over 60. Trying to lose weight. 1 or 2 eggs for breakfast is one of the smartest things you can do. And whatever your situation, the egg is not your enemy. How you cook it and what you eat beside it matters just as much. If this helped clear up the confusion, share it with someone who still thinks eggs are dangerous. They need to see this.